honestly.
Yeah, thank you for having me.
Absolutely. We are live. Good evening, everybody. Thank you so much for joining us. If you are here with us this evening, I think you're going to love engaging. Um, I love talking to PGY2 residents simply because it's a whole process getting to this point. And I think they have a lot of insight that prospective candidates can benefit from. Anytime there's one that says yes, anytime there's one that says yes, that they would be willing to engage and share a little bit about their journey with us, I'm like, yes, let's do it, please. So we're fortunate to have one today in an area that is growing exponentially in interest for pharmacists. Um, I just love seeing the transformation that's happened in behavioral and mental health and how pharmacists are really carving out a really beautiful space for themselves in this area. We have with us today Dr. Alison Panchisin. I did that right, didn't I?
It was very close. Yes,
Please correct me.
it's Panchisin. I always tell people
Panchisin.
Panchisin like magician.
Ah, you've had practice with this, I see. That's great. We have with us the amazing Dr. Alison Panchisin. She is a PGY2 Pharmacy Practice Resident in Psychiatric Pharmacy. I'm so excited you could join us today. How are you?
I'm doing well, thank you. And I just want to say thank you so much for having me. I think, this is a great opportunity to speak about mental health. And, you're right, it is very up and coming. So I'm very excited to be here.
Thank you so much for that. I really appreciate it. And that's why I was like, I'm so thrilled that you could join us so we can have some of these really amazing conversations on some of these topics today. Let's start with you telling us a little bit about yourself and so we can get to know you a little bit.
Sure. So my name is Allison, or I go by Allie, whatever. Um, I originally grew up in Delaware, and if you're aware, there are no pharmacy schools in Delaware. So
Nope.
no matter what, I had to go elsewhere. I did my undergrad at Washington College, which is a really small liberal arts college in Chestertown, Maryland.
Mm,
Um, and then from there, I actually took a year off. I didn't apply to pharmacy school right away. I wanted to take some extra classes, boost my GPA a little bit.
yeah,
And also I was still I wanted to confirm that this is what I wanted to do. It's additional for
absolutely.
4 years and it's a lot of money.
Yes,
So
ma'am.
so I took a year off. I worked at a local Walgreens. I was like
Mm,
a paraprofessional within a school district, and I was working at a restaurant that I like grew up, serving tables at. So it
wow.
was very busy.
Yeah.
I did end up deciding that I wanted to do pharmacy school. So I went on and I applied. And actually, originally, I was going to go all the way to California I was going to go to Keck Graduate Institute, which was,
Wow.
yeah. And then I was accepted after I had already sent in all of my like acceptance, my deposit, all of that over there at Notre Dame of Maryland University.
Really?
Yes. And honestly, I'm very, very close with my family, and all of them live over here. Most of my family's in Delaware now. I still have some family that's in North Carolina. I also have some family that's kind of like my oldest brother. He moved to New York, but still all kind of within this hub.
That absolutely.
So I felt like Notre Dame was a better fit.
Yeah.
So I ended up kind of just getting rid of my deposit. I just ate that cost and I accepted at Notre Dame. And I was in Maryland. I just kind of continued that because I was in Chestertown, Maryland. Then I moved to Baltimore. A little bit of a culture shock because I've
Yes, ma'am.
never done city life, but it was
Mhm,
really fun.
mhm.
Um, and then I did PGY1 in Wellspan York Hospital, which is in York, PA.
Gotcha.
I still lived in Maryland during that time, but I moved kind of a little bit out of the city,
Okay.
and now I'm in New Jersey.
Oh my gosh. You've really been true to this whole. I love that you really kind of described the importance of geographical preferences, despite your willingness, but your family construct, your support system, they're all on the East Coast. I remember when I was applying, I just had this one thing like, I don't think I have to stay close to Maryland where my family is, but I need to be able to get home fast. Like,
Mm.
I feel like if anything, like if I got a call that I needed to be home, I didn't need to book a flight, hope for the next time that there's a flight, then fly. Like I just wanted to kind of hit the road and I'd be home or get on a train and I'll be home. So I remember that. Like, so I tell students this all the time. What do you think the first step really for you when you were deciding what's going to be the next step, like for your postgraduate development and phase of training? Because I'm always curious about how people decide that a PGY2 is definitely in the cards. When did that realization kind of happen for you?
So I think once I got into residency, like getting a PGY1 already, I was like terrified. The day that I got the email, like you need to open this to see if you've matched, like, oh my God, I was so panicked. And I think, even before that in pharmacy school, I always knew that I would want to specialize, which I knew would require additional training. Or it would require me to establish myself in a health system or some kind of facility and work my way over time
Yeah,
to where I wanted to go.
absolutely.
Because you don't have to do residency to necessarily get there. It's just, I would say, fast tracking the process.
Yes, ma'am.
And so I knew, full disclosure, I even during when I was kind of applying for PGY2, I actually applied to 2 different specialties.
Mm,
Um, my entire pharmacy career, even before that, I always had an interest in mental health,
yeah.
but I also had a strong interest in emergency medicine.
Oh.
And so at my PGY1, I was lucky that I had exposure to both, but
Mm,
I felt like it made it difficult because, every
mm.
time I did a rotation in one of those areas, I was like, "Oh my god, I love this." And then I'm like, "Okay, this is where I'll go." And then I, went to the next rotation and I'm like, "Oh, wait, but I still love this."
Yeah, yeah.
So, um, I sort of for PGY2, that is, I sort of left that up to kind of I don't necessarily believe in fate, but call it what you will. I left it up to chance, like, wherever
Absolutely.
I matched was
Yeah,
where I was meant to
meant to
be.
be.
And I did. I put in some applications for emergency medicine residencies for my second year, and I did some psych. Um, I am very happy where I am. I think it's a very good match. I think every day that I leave residency or leave my job now, like it reaffirms that this is the right place for me. But I don't know, in the future, maybe I will go back and maybe I want to try my hand at emergency medicine. Who
Yeah.
knows?
Psychiatric emergencies, it's a real thing where
And there's
they.
more coming. So,
Yeah. So it's and I think one of the best things about pharmacist and residency training is like you've proven that I can learn how to do anything and be really good at it. Like it's like the thing that having residency training kind of says about you. It's like put me somewhere and hopefully I have a passion and an interest in it and then it's all over with. I can learn how to do anything and become really really good at it.
mm,
Because the commitment it takes to get through a residency, it's like nothing else. You learn so much about yourself. So along those lines, I'm always curious to hear from you guys about that transition. What was the most challenging part of transitioning from student to new practitioner, particularly that PGY 1 year?
yeah. Oh gosh. I would say like the first couple months were very challenging. Just because you're, in theory, you're no longer a student anymore, but in reality, I think it would at least when I talked to my co-residents and myself, like we had like serious imposter syndrome.
Yeah.
So like I'm like I do not feel comfortable with these really sick people, right? They're in the hospital coming to me with all of these things, and most people don't just have one thing going on. It's like a multitude of disease states coming
Yes.
at you.
Mhm.
And to have me verifying things and making sure that the recommendations are appropriate, like it was just like
Yeah.
very alarming.
I was.
And so, I think, that like having the confidence and also knowing where your shortcomings are, but also, you're just because you're no longer technically a student doesn't mean you're not still going to be a student every day. Like even now I'm learning every single day.
Mhm.
So now I'm working full time, but I'm also kind of still a student
Yeah.
because you're a resident. I think that was just the biggest struggle, and also just knowing that I did know a lot. I knew a lot more than I thought I did,
Mhm.
and then knowing those shortcomings, like, okay, I definitely don't know what to do. Who can I reach out to for help,
Yes.
and who can guide me to make sure I don't hurt this patient?
Yes. Um, I love precepting. I precept quite a lot throughout the year. One of the things I tell my student, it tells me more about how strong you are when you can recognize that I've reached my limit. I think that at this point, I need to tap someone in, or I need to run my idea about what I want to tell the nurse or the patient about this. That takes a lot of confidence and a lot of strength.
Mhm.
There's a difference. There's a difference between the person who just doesn't try and think that as their preceptor, you exist to be like their encyclopedia. They just need to come to you for everything. And then there is the person who's genuinely invested in whatever challenges they're facing. They've gone as far as their skill set can take them, but they are so nervous about asking for help
Mhm.
that they are just agonizing over, I can't choose, I can't decide. I don't know. I could do this and that would work, and I also could also do that. So I try to tell them, if you're going to do a residency, it's one of those first skill sets you have to really, really become comfortable with, recognizing your limit and asking for help. It's a patient safety concern because don't guess. It's like,
Yes.
no, don't guess. Don't be 80% sure. Don't be 99% sure. Tap some people in who've been at this a little bit longer to take your 98% to 100%, and then you move forward more confidently, and then you're engaging in that conversation with providers with a lot more confidence because you're like, i've checked I've checked
Yes.
with someone who knows a little bit more than me, and this is definitely the best course.
Mhm.
um, Imposter syndrome has literally been the most common response to that question with everybody I've talked to this series. It's just this uncertainty about, can I truly do this? Of course you can. It's like, of course you can, but it's a place you grow and get to, and accepting and trusting those skill set. And I think it's one of the most beautiful things about residency. Like when I see that growth in a resident from like fall to spring, I'm
Mhm.
like, okay, okay, superstar, do your thing. I see you. How would you then compare the transition from that PGY1 experience to PGY2? What did you notice in yourself even? I think we focus a lot on the skill set development, but as a person, if you came in with imposter syndrome as a PGY1 and you're now a PGY2, what were some of those adjustments or things you noticed in yourself from just last year?
Sure. So I think, you know, obviously, I didn't specialize in psych prior to this, so there's still things
Yeah.
that stump me, and I'm like, "Oh gosh, I need to ask my preceptor this." But PGY2, I do a lot of, self-discovery, and it's like I don't need prompting to do that, whereas in the beginning of PGY1, you still kind of are like, "Oh, I need to talk to my preceptor, like, what should I do? What should I do?" And you're asking the questions instead of looking yourself first, and you sort of learn that they're going to be like, "Oh, well, did you look it up?"
Yeah.
You know what I mean?
Oh, yeah.
So I I feel like now I'm just trained, and it's better to go into a discussion with, "I've looked this up. This is where I've fallen short. Can you assist me in either finding that new like that additional information, or kind of fill in the gaps of what I'm missing?"
Yeah.
I definitely have less imposter syndrome now. I feel
Good.
much more
Yeah.
comfortable when I make recommendations, because I know I've put in the time and the effort to really look into what I'm suggesting beforehand. And
Yeah.
also, I have that full year prior to this of practicing and still seeing a lot of the same things. I just now have a specialized population that they all have some kind of psychiatric illness, plus or minus those other medical things, which I still look at.
Absolutely.
So I definitely feel more confident in myself. And you know, PGY2 is a lot more independent, just because you have been a provider for a year now.
Yeah.
Um, and that's not to say, that my residency program director isn't, right there if I need them, or my preceptor of that rotation isn't right there should I need them. They always
Yeah. That's amazing. I think that's awesome. I love it. You're like, I have imposter syndrome to a lesser degree now. That's growth, people. that's that's
it's still there sometimes.
it's still there sometimes, but we've gone from it just feeling like a roommate. It's there like all the time and looming over you, to just something that creeps in and out over time.
Mhm.
I love that for you. I'm so happy for you.
Thank you.
What has your year been like so far, with respect to things you're working on, and um, what you've got to look forward to as well?
Sure. So, my current residency is in a like small psychiatric facility. We are well, I do all adults at my main facility, but I will have the opportunity to do pediatrics
Mm,
at a like an offsite location. Um, Lately, what am I? Gosh, I'm just about to end a rotation tomorrow, where I was working with substance misuse,
mm,
and like dual diagnosis. So, substance misuse plus some other mental health disease. Typically, it was depression and anxiety,
gotcha.
but there were others also there.
Mhm.
Prior to that, I was on it's kind of like we call it the ICU for mental health, where,
Okay.
our patients are, a lot of times they're involuntary, but they are
Mm,
likely a danger to themselves or others when they initially come.
gotcha.
It's a lot of medication not adherence, and, not
Mhm.
realizing that you do have a mental illness and you need treatment for it. And, the goal is to just stabilize you and help you realize that with the right medication regimen, you can leave here and have a great life and carry
Yeah.
on with your day to day.
Yeah.
And then I've also done a unit that is kind of a mix of mental illness, but typically tends to be a little bit to a lesser degree than the
Yeah.
involuntary side,
Okay.
with a lot of depression and anxiety as well.
Gotcha.
So on top of that, I do a weekly medication education group. So I get to have that one-on-one. Well, it's in a group setting, but I get to
Gotcha.
speak with the patients on the unit, just me and them.
Mhm.
It's kind of really dive into the different medications that they might see that are given in a psychiatric facility.
Gotcha.
And then I open up the floor to them to ask any type of medication questions, psychiatric or, hypertension, if they so
Yeah.
please. um
That's
I Yeah, I meet with them, one on one as well every day, and it's been a great experience so far.
Yeah, that sounds so amazing. That's really, really cool. I'm curious, like, why mental health? Why mental health? I think a lot of us that had any behavioral health interests like 5, 10 years ago didn't really think about this, like niching it down to this degree. It was ambulatory care or in the ED and you want to end up somewhere where you'll have that exposure to psychiatric emergencies to fulfill that behavioral piece that you wanted. I'm curious, why mental health?
So I think it all kind of stemmed from, personal, like, family reasons. So we have some mental illness in my family, where, actually during my first year of pharmacy school, one of my family members overdosed,
Oh my
and
gosh,
passed away. And so, I mean,
really?
that was a long time ago, but I think it was kind of one of those things that kind of reaffirmed because I already had that interest. Um,
Oh,
Prior to that, it was more of, wow, the brain is such an interesting thing. Someone could be depressed and be on Zoloft and it could work great, but then someone else who's depressed could be on Zoloft and it doesn't help at all. And
mhm.
so just knowing that, the brain is so complex and that there's so many different avenues or different medications that you could try to treat the same thing, and not everyone's going to have the same response.
Yeah,
So I think that, and then that, what happened with my family member,
yeah,
and then just kind of, it just opened my eyes. And I think
yeah,
I realized that there's such a gap in care for these patients. A lot of times they just get lost in the system.
yeah.
And, I don't know for sure, but I'm pretty sure out of our disease states, they are probably the highest for like rapid readmission.
Uh-huh.
And so I think, I just wanted to be the person who could be there to kind of bridge that gap and listen to these
Yeah,
people, because I think that's half the battle.
yeah.
Listen to what they feel they need, and if they're having side effects, not just being like, "Oh, okay, well, it'll go away. It'll
To
go
go
away."
away.
It's gonna
Yeah,
be it's gonna be better than you going off of this and then being manic.
yeah.
Okay, maybe, but there's other medications we can try.
You can try. Wow, thank you. I am so sorry that that happened to you, but I am so happy that you've taken something extremely difficult and
Mhm.
you're turning that into such a powerful thing for you that will be powerful for your community and wherever you practice. Your ability to relate to patients based on personal experiences is a huge, huge thing. As a kidney transplant recipient, when patients tell me that's a lot of pills to take in one day, I feel that. Like, I feel that. And I can tap into like all of my resistance over the years to, and just feeling like, how come we can't just combine these pills into one? Like, why do I have to? I think it's a really, really powerful and can be incredibly profound when you can kind of elevate the conversation based on personal experiences with patients. I'm so happy for you that you're doing what you're passionate about. It's truly, truly a gift to be like, I am doing what I'm passionate about. I'm very happy for you.
Thank you.
And thank you for sharing that with us too. That I think again speaks to your courage. So I think that some advice, and I know you have a lot. No one lands in a PGY2 by accident, Ali. Like, it's a result of some hard work and meticulous planning. What are some things you've learned along the way about through your journey in getting here that you can share with prospective candidates that are literally going to be in the pharmacy Hunger Games here very soon?
Yes. Good luck to all of you.
Thank you.
So what I will say is, especially for residency, I can't speak to fellowship, but I'm sure it's similar. Or even just, let's say you leave pharmacy school and you go right out to your job.
Yeah.
Um, I think it's really important to kind of look at yourself and look at what are the things that I need out of a job to feel fulfilled, but
Mm,
also to like get me through the day to day, because not every day is going to be a great day.
mm,
So, what are the things that are like, these things have to be checked off for me to want to work here and for me to enjoy my job? Because for residency, you enjoying your job versus not is the difference between the longest year of your entire life and a year that flashes before your eyes.
Facts.
So
Big
I've
facts.
been I've been fortunate enough that last year, I mean, truly, yes, there were some days where I was like, "Oh my gosh, I cannot do this anymore." But I most days and I look back at the year as a whole, it went by so quickly.
Yeah.
And the reason that happened is because I sat down before I applied to PGY1,
Mhm.
before I applied to PGY2, and I wrote
Mhm.
down the things that were important to me, like the biggest things.
Yes.
So things like for me were, patient interaction because
Yeah.
I like to talk to the patients.
Yeah.
I wanted to be in an environment, like specifically within my, like the people I'll work closest with, that was inviting and the people seemed like they liked each other.
Yeah. It's
Two,
important. That's very
yes,
important.
yes, because I've heard horror stories from people
Yes.
just being like, none of my pharmacy coworkers like each other, and it's just not comfortable. Like, why would you? My skin would be crawling. So I don't
And
want
then
to
here
be.
you come, like, here you come, the super bubbly, the unifier, and you're like, "Oh, what is this? I don't know what this is."
Yeah. So those things. I also, I want to be able to, like, the job I have can be very specifically PGY2. It could be very sad sometimes.
Yeah.
People have very sad situations that they come from. Um, and so, having those times where you can just kind of like relax and sit back and laugh about things, not about your patients, but about other things.
Yeah,
Um,
disconnect.
so I felt when I did my interview at where I'm currently at, like we were laughing the entire time throughout the interview. And I was like, this would be a great
Great
place to work.
sign.
Lighthearted, like
Yeah.
just light and fun
Yeah.
and in a profession that's not that way all the time.
Yes.
Um,
Very. So true. Like, the vibe on interview day is real, people. Like,
yes.
it's so real. Like, you leave some campuses and, like, you take a deep breath for the first time and you realize, "Oh my god, that's the first time I've exhaled in, like, 4 hours."
Yeah.
And other interviews, you have, like, difficulty leaving. You're having a really good time meeting and talking to people, and the conversations are not fake, like, they feel like true, genuine human conversations, like, I feel seen here, like, they're
Yeah.
listening, like, I'm engaged in what I'm hearing, and these are real, and people are always just like, "How can you tell after?" Easy, like,
It's
just
so
don't try it.
like I've had, we've done interviews and between PGY1 and PGY2, like the difference between the connections that you make from like a really positive experience and one that was like,
Uh-huh.
like you can tell. And
Yeah.
so I always, I write down what checks my boxes. And then after the interview, I sit down and I'm like, okay, what did I like? What did I not like? So
Yeah.
that, because you interview for like 2 months or
Yes.
something along those lines before you even preference. And so, I mean, the first interview I did, I didn't even really remember it, like,
Yeah.
in detail
Mhm.
versus the last one that I did that was, like, really fresh in my mind. It was, like, a week prior. So,
Yeah.
those are things that are really important, I think, you know,
Yeah.
for people that are applying to jobs or residencies,
Mhm.
fellowships, whatever.
Yeah, the literally life advice. This will fit whatever, and I have to agree with Ali here. Regardless of what your postgraduate aspirations are, this was like real, like just general life advice. Fitting in somewhere is about more than just being qualified to be there. Like, you have to like it there, and you can't just spontaneously like you have to come into a situation that's great for integrating and welcoming new people, and that start with the culture of the place with those that are already there. I agree with you so much.
Mhm.
um thank you so much. Like, I just feel like I know that a very common question, many people want to know whether your program will be recruiting at mid-year.
We will. Yep.
Yay.
And actually, because we're a part of a huge health system, all of our programs will be there.
Okay.
But we will definitely be there. It'll be myself, Henry, my RPD, and Kim, who is our director of pharmacy, who will be in attendance for our program
Awesome.
specifically.
Oh, that's great. So they'll have an opportunity to engage with you as well as the RPD and director. And then thank you. Again, I'm so grateful. And I know I say this with everybody, but it's really because I really and truly mean it. For you guys to take out a little bit of time in your busy schedules to engage with me and share your stories and about your journeys. The hope is that someone encounters this who's preparing, they're moved and inspired to also pursue psych, and they'll reach out to you, Allie, and want to connect. Is it okay for them to reach out to you with questions or follow ups or general inquiries about psych or even your program specifically?
Yes, of course. I welcome any and all questions about my program, about, my journey.
Mhm.
Even, if you're needing help in kind of like assessing PGY1,
Yeah.
I've been there, done that.
Yes,
So
ma'am.
you can ask me questions about that as well. I'm happy to help in any way I can.
Yeah. So, and I encourage you guys, I tell you all the time, you want to link up with people who did this whole thing not a lifetime ago. Like people that are fresh out of the trenches are going to have the best advice for you about how to survive it and be successful in it. So please, please take her up on her offer. Thank you so much. I am so grateful. Thank you for joining us this evening. And if you're watching us on live, thank you always for joining us. I am coming back at 7 p.m. with Ashley Andrews, who's a Rutgers Fellow with GSK right now. And I'm so excited to speak to him in just a moment here. Have a wonderful evening, Allie. And I will be looking for you at mid-year, ma'am.
Yes, I'm so excited. Thank you so much for having me. And
Of
for everyone
course.
who's watching, best of luck to you all. And please don't hesitate to reach out. I'm, like I said, happy to answer any questions or give any guidance that I can.
Awesome. Wonderful evening, everybody. I'll see you all very soon. Bye, Allie.
Bye.